Hi there, happy Monday. Today I'm going to tell you a little story. Years ago, when I was first married, I went to Hawaii on my honeymoon, and we were, sorry, we were in Kauai, and we went hiking in the Haleakala area, which is a park, and there's a lot of hiking and trails and stuff like that. And we ran into a man who had insulin dependent diabetes. And he was hiking with his wife, and he told me this story of how he had been diagnosed with diabetes and how he treated himself. So he was on this hike that was like 5 or 6 miles long, and he maintained his blood sugar the whole time that he was hiking. And one of the things that he did was he kept checking his blood sugar consistently throughout the day and then taking tiny little amounts of insulin as he needed it in order to support himself while hiking. He also had food with him to make sure that he was okay with the level of activity that he was engaging in. And I found it remarkable because he was completely in tune with his body with a very dangerous disease. And he wasn't in denial. He was completely surrendered to his health situation, and he paid attention to his body the whole time of that he was hiking, but also in his whole life. So he chose to have an active, productive life in spite of the fact that he had insulin dependent diabetes. And lately, I've been dealing with some of my patients who are getting older and having a hard time with the health issues that come along with getting older. One of my patients was recently given a pacemaker, and she had to change some of her activities, but she had a hard time with that, so she just ignored it and then got herself in some serious trouble because she was ignoring the fact that she was wearing a pacemaker and she had to pay attention to certain things. And then another patient of mine got atrial fibrillation that came on rather suddenly and then didn't want to pay attention to it. So she didn't go to the doctor, didn't go to the hospital, and fortunately didn't have any significant health outcomes because of that, but did have to spend a couple of days in the hospital getting diagnosed for her condition. And the reason I'm telling you all this is because a lot of times as we have health issues that arise, we don't want them to impact our lifestyle. So we want to keep living our lifestyle the way that we're used to living our lifestyle. And so one of the chapters in my book, Healing When It Seems Impossible, is called Trusting the Process. And the other chapter is To Never Give Up. So those are the two last chapters of my book, Never Give Up and Trust the Process. Well, trusting the process means that when you're going through a particular health journey, to trust the journey that you're on. And one of the things is that if you get a diagnosis that you don't like or that is going to impact your lifestyle, it's really hard to accept. And as we get older, getting older is one of the diagnoses that we have where we begin to have limitations in the things that we can do. When I was in my 40s, I had a car accident. And I used to do kickboxing, which I really loved because it was really fun and active. And when I had the car accident, it hurt my low back. And so I could no longer do kickboxing. And then as I got into my 50s, other things happened, like my knees started to hurt. And so skiing has become more of an issue. And so over time, certain things happen, maybe because of aging, maybe because of injuries that we can't control. And when we try to ignore those things in our bodies, it becomes more difficult for our health. So what I want to talk about is surrender. The idea that if you have something, so the story of the guy with the diabetes was so cool because he was in his 30s and he'd had health issues for most of his life, but he was surrendered to the fact that he had this condition and he lived within the boundaries of what he could do. But he did as much as he possibly could. So he paid attention to his blood sugar. He kept going doing activities that he loved, and he kept himself enjoying his life. And I want you to find a way, no matter what age you are, no matter what your health conditions are, to really enjoy your life. But enjoying your life means that you have to accept the conditions that you have and surrender to what is happening in your body. So let's say you had atrial fibrillation, or let's say you have some kind of an injury that keeps you from doing the activities that you love to do, like me with my knee, or that you have some diagnosis that is difficult to live with. And surrendering to that means that you accept that it's happening and do your best to have the happiest, busiest, enjoyable life that you can. Like for me, I can't ski anymore, but I've started dancing, and so I do ballroom dancing, which I just love, and I found a way to make that work for my knee and my body, and learning how to hold my posture a certain way and move my body in a certain way so that I don't keep injuring myself but still have fun. If you have some other health condition that looks like it's going to impede your physical activity or impede your lifestyle in some way, I know it's sometimes really, really difficult to live with those sorts of things. And especially getting older is not always easy when we get conditions that impede our lifestyle. But if you can find a way to surrender to the condition that you have, and then do as much as possible that you still enjoy in a peaceful, enjoyable way, that's what I would encourage you to do. And not to push yourself beyond whatever limits have been imposed by the condition that you have. Because a lot of times when we have a condition that's difficult to live with, if we keep fighting it and pretending that it's not there, it actually will get worse. I've had patients who had diabetes who just ignored it and just ate whatever they wanted and didn't monitor their blood sugar, and then went into diabetic ketoacidosis. I had one patient who nearly died of diabetic ketoacidosis because for years she ignored it. And then when it suddenly got worse one day, it was a problem. So, there's this fine line between babying yourself or pretending, or making something seem like it's worse than it is, and accepting it and surrendering to it and doing whatever you can within the parameters of the condition that you have. And if you have a physician who helps you sort of understand that and live with it in a way that helps you feel happy and balanced and peaceful about your life, that is the most valuable thing that you can do. I hope you found this helpful, and I will give you some more hints about it at another time in the future. Thank you so much. Have a wonderful day.